you are here on a webinar. My name is Dr. Dave Eshom, and you're on a webinar dealing with accelerated orthodontic techniques. And we're going to talk about proactive and reactive treatment planning in this webinar. Let's go on to our next slide here and tell you a little bit more about me. I'm a general dentist with 30 years experience. I'm an accredited cosmetic dentist from the American Academy of Cosmetic Dentistry. I'm a top 1% provider for Invisalign. Do quite a bit in Invisalign in my general practice. About a third of it is general dentistry, a third of it is cosmetic dentistry, and a third of it is clear aligner therapy or Invisalign. Do about 400 cases a year. And between those three things, last year in 2015, produced $2.5 million, and in 2016, on track to produce $3 million. A little bit, this is what my practice looks like, but I'm not telling you this to brag. I'm telling you this because I want you to believe it, the things I'm going to be telling you about today, and how good they can be for your practice if you just use some of the ideas that I've used. You know, I'm not a Frank Spear, I'm not a John Coyce, and I'm definitely not a Tony Robbins. I'm not this guy that can persuade Eskimos to buy ice. I'm just a normal guy that talks to my patients very openly and tells them about the benefits of dentistry, and I'm very lucky in that they accept the dentistry that I present to them for the most part. So, I do have baggage. I only graduated in the middle of my class. I first got into a capitation practice, which was heck. When I tried to leave there, I was sued by my partners, and even when I took my accreditation, it took me the full 5 years to get it. So I'm not, some whiz kid. When I did go to buy a practice that I thought I'd like, I thought it was wonderful because it was a cash practice, but the practice was all set up on $29 coupons for cleaning, x-rays, and exams. And so I had to convert that practice from a coupon practice to the practice I have now, which is all fee-for-service. We take no insurance from anybody. We have the insurance checks go for them. We have patients appreciate and value the dentistry that I present. So I'm just a normal guy that worked hard and used the techniques that I'm going to tell you about today to help my orthodontic practice grow. So I'm just an average Joe. So what we're talking about here is, clear aligner orthodontics, at least for me, but it could be fixed braces for you or whatever type of orthodontics you like to practice. With accelerated techniques, you can apply it to either one, but the main thing that I am a proponent of is providing orthodontics in your general practice, because there's a lot that can be done with it, and there's a lot of patients that can benefit from it. So a little disclaimer. I'm not employed by any dental company. I own no stock in any of the products that I'm talking about today. None of my family members do either. I have consulted with some companies, Propel Orthodontics, BioLase Technologies, and Align Technology, but I am not an employee of theirs. I've spoken for most of them. And I'm definitely not a professional speaker, as you'll find out tonight. Things are not going to be entertainment quality, but they're going to have a lot of good nuggets for you to take home and use your practice every day, because I'm a wet glove dentist. That's what I do for a living, and I feel like I'm pretty good at it, and so I can share some great things for people that are interested. So again, it's going to be reality dentistry for me. It's not going to be ideal dentistry that is, from some high tower. It's just going to be reality dentistry, and it'll share with you the secrets of my success in my 100% fee-for-service practice. So my treatment disclosure is this: I do not believe that everybody should be treated to a class 1 molar occlusion. In fact, I don't like to move molars. If somebody's happy with their bite, there's no reason to be moving it. And when I approach ortho, I approach it from a cosmetic standpoint, and making sure that the patient's are happy with the way things look. And so that's one of the reasons why I like clear aligners, is that people look better in clear aligners than fixed ortho. And I very much believe in the philosophy of Vince Kokich in treating adults, in which I mainly treat adults, is that he says that children should be treated ideally, and to me that means class 1 molar occlusion, and adults should be treated realistically, which to me means quickly. They don't want to be in aligners or fixed brackets any longer than they have to. It means they're happy with their bite. I don't have to take them into class 1 occlusion. And then, so if you're looking for that guy that locks in all his molars into class 1 occlusion, I'm not the lecturer for you. But if you're looking for a guy that has a bunch of happy adult patients with beautiful smile makeovers done without grinding on their teeth and in a very lightning speed orthodontic manner, I'm the person for you. So that's what I'll be showing you today. So that's about me and the treatment that I do. So I love orthodontics. There's nothing better than that. There's no better fulfillment I get from transforming some patient's mangled, ugly, and unhealthy dentition into a beautiful, smooth, white, healthy smile. That just gives me the biggest thrill. And even though I've been doing orthodontics for quite a while, I am just always amazed at how patients' teeth move. And when you move them into the right place, what a great smile and great function you can give them. And so in that manner, you can really change people's lives. I know people use that term a lot, but orthodontics changes people's lives. It gives them self-esteem, it gives them confidence, and it gives them a great feeling about themselves for which they can do better things in the rest of their lives. It's minimally invasive, and with compliance with the retainers, orthodontics lasts people a lifetime. And unlike other forms of dentistry that requires tooth removal, orthodontics doesn't require any. So I'm especially happy to do orthodontics or to do aligners whenever I can to make somebody smile better. And so that's how excited I get, and I hope you get the same feeling. And if you're not doing orthodontics, I encourage you to do it, because it's a wonderful feeling when you see a patient's life change by the way their teeth look and the way they smile and the way they function. So what I'm going to talk to you about is accelerated orthodontics, and I'm stealing from some cell phone companies here, but it is the next big thing in orthodontics. I mean, there was nickel titanium wires and pre-angled brackets, ceramic brackets, and self-ligating brackets. All those changed orthodontics quite a bit. But nothing is going to change orthodontics like accelerated orthodontic movement, especially when you think about manual osteo-perforation, which is going to be our topic today, as a way of accelerating orthodontics. So don't be afraid of that manual osteo-perforation. I'll explain it to you more through our webinar tonight. So this is what we're going to be going over. We're going to go over science and research. We're going to go over benefits. We're going to go over the use of this manual osteo-perforation devices. We're going to go over profitability and how it's incorporated into your office. We're going to do all that very quickly. And then we're going to get into cases and go over proactive manual osteo-perforation and reactive manual osteo-perforation, and go over some cases as to how you use it to your benefit. So why is this important? This is so important for the practitioner, for a new practitioner, experienced practitioner, someone who uses fixed ortho, clear aligners. It's important for you because the type of orthodontics you do, if you can make it go faster, it will differentiate you. It'll save you time, you'll save the patient time, and it'll eliminate a big hurdle in your treatment acceptance. And therefore, you'll see more cases. You'll get more pleasure and fulfillment by providing people with these great smiles, and at the same time be fair to you with a higher producing practice and better financial benefits to your practice too. So that's why it's so important. And if you're interested in orthodontics, this is something you need to learn about. So this is an example patient of Paul, who came into my office. And you can kind of see his upper and lower occlusal views here. and his smile, and you can see that he can definitely benefit from orthodontics in terms of making his teeth easier to clean, making his smile better, and making his function better. And so he is a recent graduate, and he's going into graduate school, and particularly his MBA, and he wants to look more professional, and he feels like his teeth are chipped and broken, and he doesn't present with a great smile. So he came into our office, and normally a case like his, I'd like you to think about how long would it take you to do his case, but in a lot of offices that would be 12 to 18 months. And later on I'll tell you exactly how long it took us to do Paul's case. Another case that is very common and run-of-the-mill for a lot of practices is this one, with some upper and lower crowding, some narrow arch form, and someone who wants to look better. As we found out, it wanted to be done in 4 or 5 months. And as we turned out, we were trying to figure out, why does she want to be done in 4 or 5 months? And I go, well, what about veneers, things like that? And she goes, no, I don't want to grind my teeth down. I don't blame her. And so this is what got me interested as one of my first cases in accelerated orthodontics. And this person, Julia, the reason why she wanted to get done is that she had interviewed with the show The Bachelor and was going to be on the show, and obviously she wanted to look her best for The Bachelor. And so we actually did her case in 3 months. And she was thrilled. We were thrilled to see her on the show, and she's appeared quite a few times now in other shows. But Julia needed to get something done, and your patients need to get things done too. And so anybody that's going to have a wedding, anybody that's moving, anybody that's going to a high school reunion or any other special occasion can benefit from accelerated orthodontics. So that's why you need to have it in your repertoire. So let's go through some of the science of that. Again, it's going to be very quickly. What MOPS is, or manual osteo-perforation, is small holes placed in the bone of the teeth between the roots so that it simulates an injury. And with that injury comes cellular proliferation that allows the bone to remodel faster, safely. And so when we talk about manual osteo-perforation, or we talk about MOPS, that's what we're trying to do. There's also another method of using high-frequency vibration to do the same thing, to stimulate the bone to remodel. And we'll be talking about those, but when you see MOPS, you know it's manual osteo-perforation, and if you see HFV, that's high-frequency vibration. So here's some science. If you cause an injury to the bone, cytokines are produced, rate of bone remodeling goes up, and bone density goes down. Consequently, the teeth move faster. With these manual osteo-perforation, the bone is temporarily softened. Someone explained it to me like you've seen basketball players that have gotten injured, and they do microfracture surgery. It's under the same principle that if you cause an injury, the cellular rate changes and someone heals faster. And so you can think of MOPS, or manual osteo-perforation, as something that's going to help somebody heal faster, but we're going to be moving their teeth while the body responds to it. So when we put force on a tooth in a certain direction, indicated by the red arrow, osteoclasts, osteoblasts start proliferating and changing so that we can move the teeth through the bone. And just the fact that teeth can move through the bone safely is a miracle to me. But when you can do it at twice the speed, I don't know what you would call that, something above a miracle. So that's kind of what MOPS does, manual osteo-perforation. And so that we can move the tooth safely without there being damage to the root or damage to the bone. When we try to do it too hard, the tooth can tip and the bone can dissolve permanently. And we don't want that to happen. And then this is what's going on in the cellular process of that. In the past, the way this was done is they'd actually cut into the bone, and it was called a corticotomy to move these teeth faster, or they did piezo surgery that you flap the tissue and then kind of put grooves in the bone. But now it's a much more genteel way, as we use manual osteo-perforation. As you can see the device there, it's made by Propel Orthodontics, is you just screw manually in between the roots so that you cause a small little injury to that area, and then that's what gets you the bone remodeling and the ability to move teeth at least twice as fast as what we could with regular orthodontics. So you may not just believe me by me telling you that, but this research was done at New York University, and they did micro osteo-perforation with a device we'll be talking about tonight, and it allowed treatment time to increase by 62%. A lot of people didn't believe that they could move that fast, so they just only moved the teeth 50% faster. But really, we can move the teeth more than 50%. I used to have patients change trays every 7 days instead of every 14 days with Invisalign, but we have found that we can have a patient change their trays every 5 days now. And so we have a 5-day protocol, even though a lot of people are just saying 7. And they did 1/2 the mouth with MOPS, manual osteo-perforations, and the other with conventional ortho. And they found the exact same thing in the mouth that we're finding now, is that the teeth move very quickly and the bone stays healthy. So here's the study. And then here's where you can see how much the teeth have moved on the patient's right versus the left. So this isn't just anecdotal. This is something that's established in science. So the other way of accelerated orthodontics is with a vibrating device. Or there's even a light-activated device. But this requires the patient to use it at least, in some cases, 20 minutes a day, or in a new high-frequency vibration device, 5 minutes a day. They're wonderful, but you have to do this every day. And so the big disadvantage is that you're relying on the patient to do it, and the big disadvantage for the patient is they have to do it every day. And this system costs more than the manual osteo-perforation. So they accomplish the same thing, but manual oste-perforation, or MOPS, is not reliant on someone complying, and it is proven to do things quicker. So here's the different manual osteo-perforation devices. These devices are made by Propel Orthodontics. The one on the left is a single-use disposable device that you use kind of like a screwdriver. The one in the middle just has a tip that exchanges and gives you a much better feel and a firmer handle to use. And then one on the right, the latest one that they've come out with, is a power one, much like our hand pieces, with controlled torque and speed, allows you to do it with that. And so that is the 3 different tools or instruments you can use to do manual oste-perforation. And to my knowledge, Propel Orthodontics is the only one that makes manual oste-perforation devices. So here's some of the benefits. It's minimally invasive. There's just a small amount of bleeding. It releases difficult movements, and you don't have to rely on the patient for compliance. There's also increased treatment acceptance because the patient realizes that, hey, I'm going to get done faster, so consequently your treatments for 1.5 years or 2 years, they go away, and they become 1 year and 8 months and 6 months. And then that reduces the patient burnout, and patient burnout, especially with clear aligner therapy, can happen, and the patient becomes less compliant with the trays because your treatment's taking too long. So manual oste-perforation has a huge benefit in that it costs less, and it's not reliant on patient compliance. So here's how it's done. You evaluate the area, you take x-rays of the area, you give the patient a chlorhexidine rinse to minimize the bacteria in their mouth, then you anesthetize, and then you use the manual oste-perforation on the appropriate teeth that are kind of your rate limiters, the ones that are going to be the most difficult to move, those are the ones you would want to use the MOPS technique on. So that MOPS technique may require 1 or 2 treatments, depending on how long the patient's treatment is. Right now, I'm allowing there to be around 16 weeks of treatment done before I need to use the MOPS technique a second time. And so when a patient's trading out his trays every 5 days, you can get quite a few trays done in 16 weeks. And so most of my cases are 1 or 2 treatments of the MOPS technique. The great thing about it is it just doesn't work right around where the tip is. There's a 3-dimensional area of 6 to 10 millimeters that area affects. And so consequently, I'm using only one perforation, and in more difficult movements, I'll use 2 perforations. But very seldom do I use 3, even though you could use 3 if you wanted to. So sometimes treatment is repeated at 10 to 12 weeks. I have it up to 16 weeks and have been successful with it. So here's the technique more up close. The single-use device, you kind of screw it into the area between the roots and into the bone. I usually like to go about 3 or 5 millimeters below the bony crest, but definitely between the apex of the root and the bony crest. And you screw it to a certain depth, 3, 5, or 7 millimeters. Most of the time I'm at 3. From time to time in a cuspid or a bicuspid area, I will do 5. And rare occasions when I go back into the molar area, you can use up to 7. On a single-use device, it has a little stop LED light, so it tells you when to stop. You would dial that up at the tip of the corner and then go from there. Then the reusable handle is very, very nice in that you just change out the tips, and then you know how deep you are going based on your visual acuity. And then there's the power driver. It has a forward and a reverse on it, and I find that this is the easiest for me to use. I use that almost exclusively now, and it does the exact same thing that the manual drivers do, but there's a little less hand manipulation that you need to do. So I find it easier to do that. So we perforate again in between the roots. And stay away from the nerves. Here's a diagram that tells you, all right, that 3 millimeters is for the anterior teeth, these are to the cuspids, 5 millimeters the bicuspid area, and if you were going to use a 7 millimeter depth, you certainly would be in the molar area. And then here shows you where those perforations are and how many you can place. But by all means, 1 or 2 is what I usually use, especially in the anterior area. This picture I circled where the perforation was done to emphasize that where that perforation goes, it goes 6 millimeters apically, it goes at least 6 millimeters coronally, and then around it in like a cone, it goes 6 millimeters. So 1 or 2 perforations, in my opinion, is enough to handle anterior teeth, because you have 6 to 10 millimeters of activity. And if you combine 2 of those, then you definitely can cover the root and bony that you needed. Here's a quick video on how the technique's done. I'm going to play it here for you. So this is the RT handle for Propel's micro osteo-perforation, manual osteo-perforation technique. And I'm placing it between the cuspid and bicuspid on my patient, and then just rotating it clockwise, watching it as it penetrates the tissue and penetrates the bone. It goes to a certain depth that I see with the lines that are on that little cylinder, and then you just stop there and you rotate back out, and then you move to the next tooth, or you move more apically to do the second one. So that's how it's done. And again, I'm not going to go over the details of it because there are other webinars that you can get the exact details and more science on it. So more summary of intervals and how often to change trays. If you are doing clear aligners. You can also use this technique if you're having trouble with a tooth that's not moving. Everything else with your clear aligners will working great. You can kind of release a movement, and I'll show you how I do that with a case later today by using it just around 1 or 2 teeth that are being stubborn to you. The main thing you want to know is that you don't want to have patients use NSAIDs. You want them using Tylenol or acetaminophen, because the NSAIDs are going to reduce inflammation, and you really want inflammation in order for it to stimulate the bone. So these are all the different types of movements that can be facilitated with the MOPS technique, and I'll show you a lot of them today in my cases. So here's where you can get more on the MOPS technique, on the science of MOPS. And so there are other webinars on this website that you can go to, and it's free. So I'll show you that again at the end of the presentation. So there are some contraindications. You don't want to do it with people with periodontal disease, patients that are particularly scared, or especially patients that have osteoporosis or have taken biphosphonate, where their bone is in doubt. There's very few of these people, but you need to be aware of them. So here's the MOP technique in summary. Teeth move faster, and in my opinion, faster than 50%. So I change my trays every 5 days instead of 14 days, and you can have someone with a very nice smile very safely using the MOPS technique. And makes it more comfortable for the patient, and there's not a compliance issue. So quick thing on the frequency, there's 2 main companies that do it. Excella is the one on the left, and then Propel has a low frequency or high frequency device that you see on the right. The one on the left you need to do for 20 minutes. The one on the right you only need to do for 5 minutes. The one from Propel. The one from Propel also it costs less than the one from Excella. So you do it less time and it costs less. So in my opinion, it is a better value for your patients, but either one works well. This is kind of what it looks like when someone's using it. And sure, he looks a little funny, but the main point I want to get across is that your patients have to do this every day. Some people may be afraid of being numbed and the thought of the osteo-perforation, but there's not that many of them. And when I explain to them that just you're sore maybe for a day and the rest of your treatment goes a lot faster, most of them accept the MOPS technique because it's less expensive and they don't have to do anything when they're at home except change your trays at the appropriate time. So great patient experience, great profitability, great efficiency. A lot of benefits with reduced patient burnout, in my opinion, and then inspiration for the patient to get finished faster, and then consequently they refer to you with a better experience than they've had at our office. In my opinion, it cuts the treatment time in more than half. There's fewer visits to your office, so it costs you less to do the orthodontic treatment because your staff seeing them less time, you're seeing them less time, and as I'll show you, there's fewer, if any, refinement because it makes things go more accurately. So, great profit center too. I think it's something that you would need to add to your case presentation, and I'll go over a little bit of that. But in my office, I have my my Invisalign fee, and then I offer as a add-on if they would like to do accelerated treatment. We offer the Propel MOPS technique. So when you go to present MOPS or you go to present accelerated technique, there's a lot of different options. You can present it and include it in your treatment. You can present it after the patient's accepted. That's a little bit about what I do some of the time, or sometimes I do it, I tell them a little bit about it during my presentation. you can do it after they've had the tray for a couple weeks or 3 or 4 weeks, you know, because they get to see, well, God, I have to have this tray and they're kind of long. And at this point, you know, it's going to take me a year to get done. He mentioned something that I can get done in 6 months. You know, let's see what that's all about. And so a lot of times when patients coming in for their second or third tray, we'll ask them how they're doing, and my staff has been trained to, if they do have a lot of moaning and groaning, to represent the accelerated technique with Propel and MOPS, so that they can always do it at any, you can do it at any tray. And then sometimes I won't do a case, and you'll see one of them today. I wouldn't do a case unless the patient was open to having a MOP or Propel technique done with their case. And so those are the ways that you can present accelerated treatment to your patients. So these are the type of cases that we're going to get into. We're going to get into cases now. We're going to show some stubborn tooth movements and how I treated it with MOPS. We're going to show some reactive treatment, meaning something that where my treatment wasn't going well, and so I decided to use MOPS to help my treatment go smoother because of a complication. And then I'm going to show you some proactive treatment that I used in the beginning of treatment, knowing that the case is going to be difficult and I'm going to need the accuracy and the dependability of the MOPS technique to help my case turn out not just at regular time, but at half the time that it normally would. So here's a stubborn lateral that I was having trouble with in my treatment. And so we use the MOPS technique here on the mesial and the distal of this number 7 tooth so that it would track better, because it was not tracking, as you can see, incisally. And so we use the MOPS technique. We're having this trouble at tray 12. And then with the MOPS technique, after doing it and placing an auxiliary elastic, the patient caught up to the rest of her treatment movement, and we're able to finish her on time. So as you know, it can be really frustrating to have cases or 1 or 2 teeth not do the movement need, and then you have to go through a whole new refinement, especially in this alignment, to get these teeth to move, or you have to replace the bracket or something like that. And so MOPS and Propel come in really handy on these stubborn teeth, and you know how cuspids and laterals can be, and so you'll see me use it on them quite frequently. So don't let that one tooth mess up your whole case or make you have to go through a whole new refinement. Go ahead and react and do it so that the tooth can catch up to the rest of the treatment. So here's some slam dunk cases that I'll show you that just go so smoothly and so quickly with the MOPS technique. So there's LeBron, the champion from Cleveland, showing you how to slam dunk a basketball, and I'm going to show you how to slam dunk some orthodontic cases. So again, here's Paul. Again, most people would think his treatment time somewhere around 12 to 18 months. Here's a little close-up of his teeth. He was in crossbite on the right side. We decided not to treat that crossbite and treat the rest of his teeth and make his bite and his smile better. And his treatment actually turned out to be, before is on your left and after is on your right. You can see white your teeth too. And his treatment time was 5.5 months. So at the time I was using a 1-week tray changing, and now I'm just using 5 days. So with those 22 trays, it worked out to 5.5 months. He was done. We saw him. He came to the office. He paid his full fee plus the MOPS technique fee, and he was in and out of our office in half the time. And he was very happy about it, as were we, and that we were able to get him done quickly and dependably with the MOPS technique. So here's his occlusal views. You see nice arch form and alignment, and then Paul being very happy, bright, white, wide smile, making him very confident going into his MBA program and becoming a new executive. So 22 trays in half the time, 5.5 months. Another slam dunk case is Vincent. Again, a big gap between his two front teeth. We are kind of wondering why he wanted to go so fast, and he really didn't tell us until the middle of treatment. That's why he wanted to do it. But there's a pretty good diastema, and you can't just pull those two teeth together and leave them angled, the roots angled away from each other. You have to pull the whole root over to get this case to be done correctly. Not an easy thing to do, and something that could be challenging and take you quite a bit of time. But with the MOPS technique, we did him in 5 months. You can see the diastema is closed. His spaces on the lower are closed. And from these pictures, you can see his roots are upright. And his papilla filled in pretty nicely too, I would say. Here's his Panorex. Roots are all fine. It was just taken recently. It doesn't cause bone loss or any root resorption. There he is smiling. And then he did tell us in the middle of his treatment why he wanted to get the accelerated treatment. That so he'd get done quickly, because when his bride was coming back from deployment, he wanted to ask her to marry him. And so we were able to get his smile all fixed up before she got home. And he greeted her with the smile you see there. And the very next day, he asked her to marry him. And now he's married. We see him back for his retainers, and he obviously is a very happy guy. And these kind of things do change people's lives. And so we need to really enjoy that, feel fulfilled because of the orthodontic treatment that we do. Okay, here's a reactive case with MOPS. Jessica, she obviously has the cross bite, open bite, narrow arches, crowding. She has everything you would want in an orthodontic case. And some of us general dentists wouldn't be comfortable treating her. But with the MOPS technique and so forth, I didn't see a problem in treating her. So, but as I did her treatment, and here's the rest of her pictures. You can see how much crowding she has, multiple cross bites. Again, I had trouble with number 6 and number 7 in getting them to track properly. They came across and corrected with the cross bite very well, as Invisalign will do for a lot of people. But I had trouble with that 6 and 7 area. And so in her case, we were able to finish her in 30 trays. Because we did some reactive treatment around number 6 and 7. So just to give you a little insight as to how I do these cases, I think about orthodontics from a cosmetic dentistry standpoint, as I told you before. And so I've done a lot of Frank Spears classes, and I think he's a wonderful, wonderful educator and clinician. And so I just use his techniques in diagnosing and treating my cases. And so the first thing I look at with Jessica is where her two front teeth are. And you can see they're in pretty good position, but they're slightly canted to her right. And then from there I go to the next tooth, which is the laterals, and we can see the laterals behind. So I like to pull it out even with number 8, and even number 10 is slightly lingual version. She's in crossbite on her right side. She is crowded on the lower. And so I think about widening her arch to try to get that all to fit. I think about leveling her occlusal plane, and I think about putting her teeth into alignment. What is all that stuff? I mean, we think about it with veneers and cosmetic cases, but the best way to, with orthodontics, use her own teeth. Her teeth are gorgeous, beautiful central incisors, nice size and shape, a little bit of whitening that'd be a great color. And so that's how I do these cases, and think about, can I level her occlusal plane? Can I widen and broaden her smile to make it not only look better, but help me fit her teeth in her arch? And what we did with Jessica, with some IPR, we were able to get her arch to fit. And so when you see me, this line, the bottom line there where it says treatment plan WLA, the majority of my treatment plans are widen the arch, level the occlusal plane, that's what the L stands for, and A, align the teeth. you do those three things well, and you're going to have a nice fitting arch, a nice looking smile, an arch that's easy to clean, and a patient that's very happy and very confident about their smile. And so that's kind of how I treat these cases, and clear aligner therapy, especially Invisalign, helps me do that. So here's Jessica after. Her arch is widened, her teeth are upright, the laterals went exactly where I was thinking they were going to go. When you follow the edges of her teeth, her cusp tips, incisal edges to cusp tips on the other side, she has a broad symmetrical arch and very, very beautiful smile. So, and this was all accomplished in those 30 trays that I told you. But I had to go and worry about and let number 6 and number 7 get caught up with the treatment plan, because at one point those two teeth were not tracking properly. And so how do you do that reactive treatment? I have MD 3+3. We have her go back to her last best fitting tray on the mesial and the distal of the teeth that are not tracking. We place one or two micro or manual osteo-perforations, and then we give her 3 more trays and come back and check, and those teeth catch up. All by themselves, they catch up. And so it's something that has bailed me out of case not finishing in the right time and from having to do refinements by using this reactive technique. So MD 3+3, think about that when you want to do a reactive case. So here's Jessica's occlusal view of her arch. Upper and lower fit in with the IPR that we did, and her smile still looks full and did not change. She's not looking too bucky. Her teeth are kind of at the right angles, nice and wide, symmetrical smile. Teeth all fitting, easy to clean, and they are in great function too. So Jessica is a great case for reactive micro osteo-perforations, MOPS, done by the Propel device. So here's a summary of her case. She lost some tracking. We did the reactive technique on her. We got her to finish time. Her treatment time was 13 months. She had only 1 MOP session around those 2 teeth. And we saved this case from having to do refinement. And there's Jessica. You can see how pretty her smile is. And before, she didn't have a pretty smile. She wasn't confident, but she had all the makings of one. And what I tell patients like Jessica is to motivate them, to have them think about what their smile is going to look like. I tell them, Jessica, you've been given very, very expensive furniture. The furniture are your teeth in your mouth. Your teeth are gorgeous. Each one is individually gorgeous, just like expensive furniture is. All we have to do is rearrange that furniture in the appropriate way, and you're going to have a very nice home and garden room or a nice home and garden smile, because you have all the makings of it. You have the bones, you have the structure. All we have to do is rearrange the furniture with some clear aligner therapy and some cooperation, and in this case, manual osteo-perforation, and you can have the smile of your dreams. And that's exactly what I think Jessica has. And so explaining to patients what they're going to look like and having them envision what it is and telling them that they could do it and giving them the confidence that, hey, all I need to do is go through this orthodontic process and I can have that kind of smile, and they'll be motivated and they'll see the benefits of what you're talking about. So use that if you can. So the slam dunk cases are cases that used to take 18 months, 15 months. You get them done in 8 or 9 or 7 months or 5 months, as you saw. You know, cost is a big factor whenever you're presenting these cases. And if you get someone over the cost, you usually get them to do the treatment. And sometimes you get them over the cost, but then we tell them that it's going to be 18 months or 24 months. They're not into that. As an adult, that's just too long. But when you can tell them that they can be done in half the time, you take the second biggest factor to people rejecting your treatment plan, which is time. It's going to take too much time, doctor, for me to do this, so I'm just going to live with my teeth the way they are. But if you take that time factor out of the denial phase of their thinking, and you can get them done in 5 or 9 months, all of a sudden, oh wow, I can do that, and I Can you say I can have that smile? Can you show them what a smile like theirs can look like? They're going to accept your treatment, and they're going to love it. And then a lot of times bring it up with patients and hygiene. Have your hygienist bring up how quickly orthodontics can be done nowadays in a safe manner. The Dr. Eshom does accelerated orthodontic treatment, and he can get you done 3, 4, or 5 months. That really motivates the patients that have been hesitant to do your orthodontic treatment in the past. So here's some more cases that we kept in-house. I talked to these cases about in-house treatment because a lot of cases that I use MOPS for would be cases that I may have referred out to the specialist, the orthodontic specialist. But now I feel more confident with the MOP technique to be able to take on some of these cases, and I proactively do the MOPS technique to help patients like Lauren. You know, he's a military member in the Navy here in San Diego. He is a burly, strong, very fit guy, but he's inhibited because he has what most people would describe as a goofy smile. He just doesn't look intelligent. He doesn't look confident when you smile and you have your 2 front teeth sticking out, and there's a space the size of the field goal post right there in the center of your mouth. And so he came to us, and we explained to him that, hey, we can help you. We may not be able to help you all the way, but we're going to get you pretty darn close. And let me go over his case with you to show you exactly how he turned out. Here's his pictures. You can see how much spacing he has there on the closal view here. And he has misshapen laterals, or peg laterals, lots of space. He has a deep bite. He has narrow arch form. He has crowding on the lower and spaces on the upper. So his arch is totally asymmetrical to each other. But he has the makings of what could be a good smile with some orthodontic and accelerated treatment. So we took x-rays, made sure everything was clear around the root so that we could do the MOPS technique. Here's his clean check, showing the IPR that we're doing on the lower and showing the condition of his mouth when we get started. And we're doing 25 trays. One thing I look at, since I do use Invisalign, is this treatment tab on the right-hand side of your clean check. You scroll all the way down to the bottom, and it shows you where the difficult movements are so that you know exactly where you need to do your MOPS technique. You can see on number 14 and a lower left bicuspid and a lower anterior teeth that there's some difficult movement. So I know exactly where the problems are when I'm using Invisalign and their clean checks. So that's exactly where we do the MOPS. I do the MOPS from cuspid to cuspid and around any difficult teeth that are not taken care of. So we do lower cuspid to cuspid. We'll do number 20 and we'll do number 14. So here's his arch form before. As you know, my goals are to widen, level, and align. He has a very uneven occlusal plane, very uneven incisal plane. He is narrow, and so we are going to correct that as part of our treatment plan. So here's his before upper, and here's his after upper. Here's his before lower, and with his bondage lingual bar on the lower, you can see that we're able to expand his arch and align his teeth. Here's his before and after smile. So Lawrence has an ideal smile now where he used to have a goofy smile. And we did his treatment very, very quickly. And then here's his before and after up close. We use BioClear bonding techniques on his laterals because you can see they're misshapen. And then the centrals look funny after we close the space. And so we reinforce the incisal edges and reshape the teeth so to a more appropriate size for the size of person he is. Here's his before treatment. Here's his after orthodontic treatment. You can see where we got his teeth to. There, we intentionally left some spaces on the distal, his laterals, so that we can make the appropriate laterals. And then we decided to reinforce his incisal edges to have his central be a little bit longer and more horizontal plane. But that's what Lawrence looks like. And this was a huge difference to him. He is a nice guy, a gentle guy, and now he's become a nice, gentle, confident guy. And so we're very, very happy for him, and he comes in time to time, and we get to see a great personality of Lawrence. And so here's his treatment summary. He started in June. He finished in February, so that's just 7.5 months. Have you seen cases done like this in 7.5 months with regular technique? I don't think so. We did 2 Propel MOP MOPS sessions, and then we used BioClear treatment to finish them up. So I think it's a great and successful case. Let me roll on to Lane. What do you think's wrong with Lane? It's kind of obvious. It's right there in front. Lane has lived with this his whole life. He was not afforded orthodontics when he was young, and when he became a young adult, you know, the orthodontist told him that he needed to have jaw surgery. He was not into that at all. And so I don't know what got him frustrated, but he was trapped for 15 or 20 years is what he said with these. And then finally he heard about Invisalign, and he went to one provider, and they laughed out and they go, "There's no way you can be treated with Invisalign." And then he called me because I'm the #1 provider in San Diego. And I talked to him, I actually talked to him on the phone, and I said, "Come on down. I may not be able to make you perfect, but let's see if I can improve things." So he came down, we talked, I looked at his teeth, and I looked at his open bite, and I said, "Well, how would you feel if I was able to fix half of your open bite? Would you be happy with that?" And that's the way you can approach some of your patients that are trapped like this. Would you be happy with a half improvement? Do you have to have perfect? If they say no, then they're okay to treat, because the only other choice he has is surgery. And so I told him, if I could fix half of that, would you be happy? He said yes. And so I said, let's do it, but I want to use Propel. I want to use the MOPS technique to make sure that this really does happen. And so here's his case with his pictures. I mean, it looks like you can take a tire iron and stick it between those teeth with him biting. I talk about a level of occlusal plane. He is the exact opposite. He has open bite. He has crowding. And he needs a wider arch. And so widen, level, and line with treatment is my treatment plan for him. We take the x-rays to check the bone. We do the clean check. We hit the treatment tab up here to look. He has 20 lower trays and 24 lower trays and 20 upper trays. This is his treatment movement assessment, and he has some difficult movements in the front part of his mouth. Here they are up close. Looks like number 5, number 12, lower 2 anterior. So again, we do MOPS from first bicuspid to first bicuspid, and then we do from cuspid to cuspid on the lower for him. And here's a picture. They say at the American Dental Association that the classes that show the most blood get the most attention, so I thought I'd put this picture in and keep you awake with some blood. But this is basically what it looks like after the MOPS technique directly. We rinse that blood away and everything stops, but you can see the little puncture holes. I just did one around each of his teeth and in the bicuspid area. And this is a retreatment because we were losing track on the lower anterior area. So we retreated him with MOPS, and then we made him some new trays. And then this is his second clean check of 9 uppers and 10 lower trays. And that was redone at tray 18, I think. So he still finished with 30 trays. Here's his before and after. You can see his occlusal plane is very close to being level. He has his arch widened. He has as you'll see later, actually an overbite situation. And so we changed an open bite that looked like 6 or 8 millimeters and almost made it perfect. So here's his retracted view with him open, and here's his view with him biting. We actually got some overlap. We actually corrected some of those posterior cross bites, except again number 30. But we did a great job for him, I feel. Again, it's not perfect, but it changed the way Lane thought of himself. It made his teeth healthier. It made his smile nicer. And so he got a great value. Well, let me point out this, that you can place lingual buttons, and that was a big part of his treatment. It's hard to pull these teeth down and extrude them without any buttons, and most patients don't want them on the facial. So place them on the lingual if you're an Invisalign provider, and you'll get a better grip of those teeth, and as you can see how much they can move. They moved for me. So here's Lane before and after. A tremendous change. He was a very positive, motivated person, but with this smile, he's very positive, very motivated, very confident, and he feels like he got out of the cage that he was in with his smile. He was trapped, and the only way out was surgery. And you can help these patients that are trapped with great orthodontic technique and the MOPS treatment. So technically, I would not have treated Lane without MOPS. But now I could take on more difficult cases with MOPS because of the predictability it would get me. If I started having trouble with teeth tracking, with his case, it would be nothing but frustration in 3 years because he'd get tired of me, I'd get tired of him, and we'd just quit. But with this, we were able to get Lane done in a very short amount of time that is less than a year. We got him done in 10 months instead of 2 or 3 years, even though I said 1.8 months. We did 18 trays, had some tracking problems, and then we did 10 more trays for a total of 28 trays. We did 2 MOP sessions, and then we did a little bonded restoration around some of the chips on his teeth so that they look more like natural teeth. But what a great thing for Lane, and what a great thing it made me feel so good to be able to help somebody like him, someone that felt trapped with their smile. So you can do it too with MOPS. So the summary of our proactive and reactive MOPS technique, MOPS helps you. It helps you be more, your treatment be more predictable, helps you finish in a short amount of time, helps you be more profitable with your treatment because you finish doing it. MOPS helps your patient. They don't get burnt out. They don't feel like this thing's never going to end. They help keep them motivated in their treatment because they can see the light at the end of the tunnel. It takes your long cases and makes them regular cases, like the case for Lane. It takes your regular cases and makes them the short slam dunk cases now. It allows you to increase the difficulty of the cases you take on because MOPS is more predictable. It gets you more cases in your office because of your treatment modality is expanded. And then the best thing about MOPS is that you can change more people's lives. When you change someone like Lawrence's or Lane's smile, you've really changed their life. You've given them the confidence to go and accomplish everything that they can accomplish because they could come up to anybody and talk to them confident. Whether it's a relationship, a business, a customer, whatever it might be, and it will give them the confidence to be able to approach them and do some of the things that they didn't think they were done. So I hope you learn from these cases. I hope you see that you can do these cases with the help of accelerated orthodontics and MOPS. So now I'm going to open up the presentation to questions. You can type them in here and I'll be answering them. So I don't see very many questions here for the audience, but if you have any and you want to email me, my email is here. In November, I'm going to do the part 2 of this presentation, which will be more of the practice management part, motivating patients, how you present, and then how you use it and how profitable it can be. And so thank you for your attendance. Before you go, though, I want to give you Catapult Education and their website, that if you'd like to get more information about the MOPS technique, there's another presentation there that shows you more about the technique and more about the science, because as I told you earlier, we were going to just go over that very, very quickly because it's been presented 3 or 4 times with other webinars. So thank you. Look, please tune in to my November 22nd webinar, and I appreciate your attendance today. So have a great night.